Hey there and welcome back. Today we'll talk about the radiographs needed for proximal humeral fractures. There are three main views that should be obtained: the true AP view, the axillary lateral view, the scapular bilateral view. Those three main views are called the shoulder trauma series. Let's start with the true AP view, which is also called Gracious view. In order to obtain a true AP view, there are several ways to do so. The simplest way is to rotate away the unaffected shoulder 30 to 40 degrees, allowing the injured side to rest upon the X-ray cassette. Notice if the AP radiograph taken without performing this maneuver, there will be an overlap of the head with the glenoid rim, and that's not a true AP view. Next in line is the conventional axillary lateral view. This view is not only painful for the acute patient, but it can cause further displacement of the fracture. So it's preferred to do a modified view called the Villepot view. This view is obtained by directing the X-ray beam from superior to inferior as the patient leans backward 20 to 30 degrees over the cassette with the arm in a sling. Finally, the scapular bilateral view. It's obtained by placing the anterior aspect of the affected side against the X-ray cassette with the other side rotated out 40 degrees.